Hi, this is Dr. Ken Muich, Fibromyalgia Wellness Center, and welcome. Happy Monday to you. Hope everything's going well. In Arizona, we've had quite a few storms, a lot of crazy weather that has inundated our state, especially the Phoenix metropolitan area recently. Today, it's just very, very interesting. This is number 36 live video. I'm very, very happy to say that I have a lot of wonderful people that actually participate and listen. And if you by chance want to go back to the other 35 or listen to number 36 again, you're more than welcome to do that because every one of these have been on the subject of fibromyalgia or related subjects that actually either indirectly or directly relate to fibromyalgia. During these 36 various seminars or live videos, they've covered everything from the history of fibromyalgia to confusion with other fibromyalgia, with other conditions that actually cause problems. That's why doctors have such a difficult time diagnosing them. Food that actually inflames fibromyalgia patients makes their condition worse. Fibromyalgia triggers or certain things that trigger fibromyalgia to make, again, their condition worse. How omega-3 can positively affect them. We also touched upon marijuana and how marijuana might very well be a positive aspect for fibromyalgia patients, especially the CBD oil. We also talked about the FDA and pharmaceuticals and how it seems as though the FDA oftentimes is killing you instead of helping you with a lot of the decisions or non-decisions that they make. We also talked about in patient successes and also patient failures and why they fail, what brings them to a failure aspect. And also we talked about the fibromyalgia protocol. And there's so many different wide and varied things that we've talked about concerning fibromyalgia. It's been a real pleasure, and I continue doing this in the respect that hopefully this knowledge and information will get to you in one form or another. You can always refer it back to it again. Just look under the Fibromyalgia Wellness Center live videos, and each and every one of them have been saved. But I've been getting a number of comments back from people that watch the program. And it's about the diagnosis of fibromyalgia and the fibromyalgia patient itself. How do I do it? And what do I look for? And what differentiates me from other doctors, the MDs and DOs, the allopaths, and a variety of other doctors? What makes our program better? Sorry, I can't believe I got a phone call coming in again. Once every, I think, month, I get somebody that tries to call in. So I thought what we would do is review with you what we actually do to help diagnose the fibromyalgia patients properly. The most important thing is it's a diagnosis of elimination. And what we want to do is make sure that we diagnose the patient properly. Now, the important thing also is that every fibromyalgia patient or prospective fibromyalgia patient that comes into clinic has some other condition or multiple conditions that fibromyalgia makes worse and also makes it difficult to diagnose properly. So the history is extremely important as far as the overall diagnosis is concerned. We spend probably anywhere from 45 minutes to an hour just in the initial consultation to find out whether or not the individual that comes in, male or female, actually may very well have fibromyalgia. Now, fibromyalgia is under the auspices of rheumatologists. It's not a rheumatological condition. Rheumatological conditions involve, for the vast part, bone destruction and damage, so to speak. Fibromyalgia is not like that at all. It has a lot of similarities, aches and pains and so forth, but it is not a destructive disease in that respect. So what we do is we spend a lot of time not just on the medical aspect as far as the patient when he comes in. We ask a lot of questions. We ask a lot of questions as far as the social background that he has, the childhood, traumas that he may very well have, or she may very well have had, as far as the overall development of the child itself up to the present. We know that research and history shows that fibromyalgia, you have to have the symptoms for at least 3 months continuous. And they're not localized. It's not 3 months of shoulder pain or back pain. This is whole body pain that goes all over, and it moves all over, okay? It's not just in one place, but also it has other aspects such as irritable bowel and celiac disease and rheumatoid arthritis and osteoarthritis, MS, Lyme, lupus, headaches, migraines, all the different things that other people just take for granted, so to speak. These are kind of latched on to fibromyalgia as some of the other secondary conditions that fibromyalgia patients have. And many of these are the primaries. I don't think you'd say MS would be a secondary condition, and yet fibromyalgia, working with these, makes every one of them worse. And so it's very, very difficult sometimes to differentiate. Matter of fact, that's why MDs and DOs and so many other doctors get confused, because they look at the initial aspects, initial symptoms, and so forth. They maybe send them out for objective tests, which would, as I mentioned before, blood chem, urinalysis, CBC, all these different things. Well, the problem with that is that fibromyalgia patients, they come back negative unless they have some other secondary condition. So if they have a secondary condition, well, right away they just put them on meds for that secondary condition. When I say secondary condition, again, I'm looking at fibromyalgia as the primary. That's what I'm looking for. So when patients come in, I spend time also asking them about the other diagnoses. And some patients come in, they've been diagnosed with 3, 4, 5, maybe other conditions. And also the medications that they're taking. What are the medications? Oh my goodness. When a patient comes in and gives you an 8.5 by 11 sheet of paper with medications, you know that there is a problem as far as the diagnosis is concerned. I had one patient come in, and I covered this, as a matter of fact, in one of my previous live videos. And she had, I think, 12 or 13 medications, of which she was given cancer medication. She didn't have cancer. Thyroid medication, she didn't have a thyroid problem. High blood pressure medication, she didn't have high blood pressure. 2 opioid medications, and also a medication for constipation, because opioids cause constipation. So the vast majority of her medications were for things that she wasn't even diagnosed with. It's almost like doctors take many of them, they just take something and throw it at the wall and say, well, I hope it sticks. Let's see what this works for. We're much more thorough, and believe me when I say that. And most of the patients that come in, they're surprised at the amount of time and effort that we take in going through things. So the medications, and do the medications match the diagnosis? And are the medications having side effects that are the same symptoms that fibromyalgia patients come in with? I mean, if they cause muscle aches and pains, and the fibromyalgia patient says, I'm having aches and pains all over my body, that's not the right medication, right? So we have to discuss that with the patients. We also talk to them about triggers, not as in guns. These are triggers that research have shown that exacerbate or bring on fibromyalgia. Now I'm going to say bring on because I'm going to step back in just a few moments and explain something. But fibromyalgia research has shown that some physical, emotional, or chemical traumas, or multiples thereof, actually trigger fibromyalgia. Well, that's not 100% true, because with our research, fibromyalgia patients have a genetic marker that already is in their body, and it causes excess amounts of phosphate and calcium in their cells. I've covered this before if you want to look back at some of the different things. And a lot of patients that come in, and I hear this so often, ladies or gentlemen say, I kept on going to a doctor. I wasn't feeling well. I just didn't have the energy, didn't have the strength, and so forth. And every time I went to the doctor, they kept on telling me, I have growing pains. Well, I'm 40 years old. I don't think I'm growing anymore. Well, because the doctor missed the diagnosis, to be honest with you. You don't have growing pains. The fatigue and aches and pains and so forth that you have are some of the primaries of fibromyalgia. And so that can be a real problem. But what we're talking about as far as triggers are this. If you have an auto accident, and I've had this in my clinic, non-existing fibromyalgia, maybe something that was missed. All of a sudden, halfway through treatment of taking care of this patient that had auto accident, all of a sudden they plateau and they drop right off the cliff. They have all these new aches and pains and so forth. And so when we start to diagnose, we find that person had a low-level form of fibromyalgia that was made worse, exacerbated by automobile accident. That's the physical, or a surgery, or a severe illness. Emotional, it could be the loss of a family member. I'd say at least 25%, maybe higher, of my patients have been either assaulted or raped. And we're talking about both male and female. Many times they don't bring that out. And I know we've gone through these things with the Supreme Court justice and all this stuff. These people don't like to talk about this. They do not like to bring this up even years afterward. And it's a physical and emotional strain when we deal with this with patients. Get maybe 5-10% of military coming back, PTSD from the strain. That triggers also the chemical reactions and causes the problems with fibromyalgia patients. And that has been shown in history that wartime triggers with fibromyalgia are quite common. And if you ever have a chance to review it, matter of fact, I did the history of fibromyalgia some months back. Again, how especially in the world wars, World War I, World War II, Civil War, and so forth, how many of the soldiers were actually had this disease, but they couldn't understand it. They didn't know what it was. Even in the Civil War, they had 3 hospitals. They had a hospital for actual injuries, gun, whatever. They had a hospital for syphilis, because wherever the Army went, so also did the ladies. And the third one was for this non-traumatic type of condition that the soldiers would literally just fall down, be unable to function, severe pain all over their body and so forth. That was an undiagnosed fibromyalgia condition. They didn't really know what it was at the time. And in history, fibromyalgia has probably a dozen or more different names. Everything from fibrositis to fibricula to a variety of different names. Neurasthenia, a variety of different historical names that fibromyalgia has gone under. So that would be the emotional. Chemical would be molds and spores, okay? You get sick from that. A lot of fibromyalgia patients come in, have severe sensitivities to fragrances, odors, and so forth. And so those can also trigger the excess amounts of fibromyalgia. And fibromyalgia patients can walk in like you and I. If you don't have fibromyalgia, look just like you and I, hopefully better than me, and say, I think I have fibromyalgia. Whereas other patients that come in, they have sometimes wheelchairs, sometimes walkers, sometimes literally staggering in, holding onto walls, trying to get in because of the fatigue and pain and so forth they're going through. And so we have to take that into consideration when we look at people. The American College of Rheumatology in 1990 established a paper actually naming fibromyalgia and actually bringing all these different things together, myofascial problems and all these other conditions that were kind of like strands out there. And they couldn't really understand how these things work together. Not until the 1970s where some scientists actually were able to put these together and actually find that they were related, and they actually named it fibromyalgia. And it's instead of fibrositis, because it's not an itis, it's not an inflammation, it's an ongoing algia, ongoing pain. So during that American College of Rheumatology paper, they also found a commonality as far as 18 specific tender points, of which fibromyalgia patients have the majority. They have to have at least 11 out of 18, either mild, moderate, or severe. And that's another one of the steps that we find as far as fibromyalgia and diagnosing them properly. Is it the only one? No. All of these go together. The history, asking questions, the triggers, the physical, emotional, chemical, so forth and so on. Then what we do, we look at all the white smoke. Now, that's smoking like cigarettes and pipe and cigars. When I say white smoke, it's all the things that confuse other doctors, okay, and secondary conditions, as I mentioned, that fibromyalgia patients have, because there are so many whose symptoms are very, very similar to fibromyalgia. And so we have to differentiate those. And so by doing that, we're able to actually take those in and separate those. And that was in, let's see, similar symptoms, so forth. That was in video number 4, as a matter of fact. Similarities as far as the symptoms are concerned with fibromyalgia patients and non-fibromyalgia patients, other conditions. So if you want to go back and look at the talk I did, it was video number 4, way back when. After all of that, then what we do is we do a thorough orthopedic and neurological exam on this individual. Again, we're trying to differentiate the patient's other conditions so that we can treat the fibromyalgia and also hopefully minimize some of the symptoms of these secondary conditions. We have found a vast majority of time that when we reduce the fibromyalgia symptoms, we are actually helping reduce the other secondary condition symptoms also, oftentimes because they run together. And so that's how we actually take these. Before we go into our pre-protocol of anti-inflammatory detox program and the regular program itself. So we go through all of this other information to make sure we diagnose the patient properly. Years ago, I used to send all my prospective fibromyalgia patients to rheumatologists, but then after a while they were saying, yeah, just take care of them. We're just going to give them meds. We don't have any other answers for them, and so you might as well try your approach, which we've been very, very successful on. So again, how do we do this, and how do we differentiate ourselves from the other doctors that diagnose fibromyalgia patients? Number one, we're very, very thorough. We spend a lot of time on the history of the patient. We look back into the social and the childhood and so forth. We find out how long they've had the problems. We look at the whole body. We look at the other conditions that they have and the previous diagnoses. How many diagnoses do they have? And are they giving meds for them? And are the meds actually making their conditions better or worse? Are they actually making their symptoms worse? And then the trigger points, physical, emotional, chemical. How have they affected them throughout their life? And then, of course, the 18 specific points of pain, which research has shown you have to have at least 11 out of 18. And the nice thing about it is once they get through our protocol, they usually have little to none. They may have a couple of them, but it's probably based upon secondary conditions, maybe osteoarthritis or some other condition itself. But they're down to a minimum. They wouldn't even fit into the category of fibromyalgia. And then we do the thorough orthopedic neurological tests to, again, separate the secondary conditions and maybe even surprise somebody with some additional conditions maybe they didn't even know about before they even go into our protocol itself. So I hope this answers a lot of your queries and questions that people have as far as how we differentiate and separate ourselves from so many of the other doctors that try to diagnose fibromyalgia. Chiropractic is not the answer for fibromyalgia. It does help and take care of secondary conditions. I am a doctor of chiropractic. I also certified licensed in acupuncture, physiotherapy, rehabilitation, cold laser, all the different things that might help the secondary conditions. Also some of the fibromyalgia conditions as far as cold laser and things of this are concerned, because we look at the overall picture. But our protocol is primarily one in which we treat the condition and not the symptoms, and that's the most important thing. So I want to thank you very, very much for joining again. Look back at some of the other live videos that we have on so many of the subjects that we've covered and talked about. Tonight from 5 to 7, you're not invited, sorry about that, but the doctors are invited. We have an online seminar on the actual treatment of fibromyalgia patients itself. So we're going to be training doctors tonight. It's 6 two-hour seminars on Monday night that we'll be going through everything online. Hey, thank you so very, very much. Have a great week. Enjoy. And if you have a chance, take a look at some of the previous live videos. You might pick up some hints on some treatment and some things that might reduce some of the symptoms and pains that you're having. Thank you so very, very much. Next week, same time, 12:30 p.m. Monday, we're going to be covering another subject. Just look, I'll be introducing you, letting you know what that subject might be. Again, thank you very, very much. Have a wonderful. See you next week. Bye-bye.